Good day everyone, my name is Crystal Clara Saldua. I will be reporting for today. Our topic for today is all about teenage pregnancy. Teenage pregnancy, adolescent pregnancies are a global problem but occurs most often in poorer and marginalized communities. Many girls faces considerable pressure to marry early and become mothers while they are still a child. Teenage pregnancy increases when girls are denied the right to make decisions about their sexual and reproductive health and well-being. Girls must be able to make their own decisions about their bodies and futures and have access to appropriate healthcare, service, and education. What causes teenage pregnancy? Lack of information about sexual and reproductive health and rights, inadequate access to service tailored to young people, family, communicate, and social pressure to marry sexual violent child, early and forced marriage, which can be both cause and consequence, lack of education or dropping out of school. Other factor contributing to adolescent pregnancy. Approximately 90% of births to girls and 15 to 19 in developing countries occurs. No access of contraception and pressure on girls to have prove their fertility. Factors such as parental income and the extent of girls' education also contribute. Girls who have received minimal education are 5 times more likely to become a mother than those with higher level of education. Pregnant girls of 10 drop out of school, limiting of opportunity for future employment and perpetuating the cycle of poverty. In many cases, their girls perceive pregnancy to a better option that continue their education. In addition, the unique risks faced girls during emergencies increase the chances of them become pregnant. Factors include the desire to compensate of the loss of a child, reduce access to information and contraception, and increase sexual violence. What the effect of teenage pregnancy? What are the effects of teenage pregnancy? How does teenage pregnancy can affect girls? Adolescent pregnancy remains a major contributor to maternal and child mortality, complications relating to pregnancy and childbirth are the leading cause of death of girls aged 15 to 19 globally. Pregnant girls and adolescents also face their health risks and complications due to their immature bodies. Baby born to younger mother are also greater risk. For many adolescent pregnancy and childbirth of neither planned nor wanted in countries where abortion is prohibited or highly restricted, adolescents typically resort to unsafe abortion, putting their health and lives at risk. Some 3.9 million unsafe abortion occurs each year to girls aged 15 to 19 in developing regions. Adolescent pregnancy can also have negative social and economic effect on girls. Their families are communities. Unmarried pregnant adolescents may face stigma or rejection by parents and peers as well as the threats of violence. Girls who become pregnant before age 18 are also more likely to experience violence within a marriage or partner. How does Plan International support girls? We're committed to tackle adolescent pregnancy, especially among younger adolescents aged to 10 to 14 who are most risk and often overlooked. We all support girls who have already become mothers by raising girls' awareness of their sexual and reproductive health and rights, protecting them from abuse and connecting them with education and health service. We support the K educations they make about their future and bodies. We call on government to strengthen national health system, implement preventive education on sexuality and relationship in and out of school, and provide affordable, safe contraception to tackle the root causes of pregnancy. We also demand government to support pregnancy, girl and young mother to continue and complete their education. Pregnancy occurs when a sperm fertilizes an egg after it released from the ovary during ovulation. The fertilized egg can travel down into the uterus where implantation occurs. A successful implantation results in pregnancy. An average of full-term pregnancy lasts 40 weeks. There are many factors that can affect a pregnancy. Women who receive an early pregnancy diagnosis and prenatal care are more likely to experience a healthy pregnancy and give birth to healthy baby. Knowing what to expect during the full pregnancy term is important for monitoring both your health and the health of the baby. If you like to prevent pregnancy, there are also effective forms to birth control you should keep in mind. Symptoms of pregnancy. You may notice some signs and symptoms before you even take a pregnancy test. Other will be appear weeks later as your hormones level change. Missed period. A missed period is the one of the earliest symptoms of pregnancy and may be the most classic one. However, a missed period and this doesn't necessarily mean you're pregnant, especially if your cycle tends to be irregular. There are many health conditions other than pregnancy can cause a late or missed period. Headache. Headaches are more common in early pregnancy. They are usually caused by altered hormone levels and increased blood volume. Contact your doctor if your headaches don't go away or especially painful. Spotting. Some women may experience light bleeding and spotting in early pregnancy. This bleeding is most often the result of implantation. Implantation usually occurs 1 or 2 weeks after fertilization. Early pregnancy bleeding can also result relatively minor conditions such as infection or irritation. The latter often affect the surface of the cervix, which is very sensitive during pregnancy. Bleeding can also sometimes signal a serious pregnancy complication such as miscarriage, ectopic pregnancy, or placenta previa. Always contact your doctor if you're concerned. Weight gain. You can expect to gain between 1 and 4 pounds in your few months of pregnancy. Weight gain become more noticeable toward the beginning of your second trimester. Pregnancy symptoms turn early signs that you may be pregnant. Pregnancy-induced hypertension, high blood pressure, or hypertension sometimes develop during pregnancy. A number of factors can increase your risk, including being overweight or obese, smoking, having a prior history or a family history of pregnancy. Induced hypertension, heartburn, hormones released during pregnancy can sometimes relax the valve between your stomach and the esophagus. When stomach acid leaks out, this can result the heartburn. Constipation, hormone change during early pregnancy can slow down your digestive system. As a result, you may become. That's all. Thank you for watching. Have a nice day.